Yes, hello everyone. A very warm good morning to one and all. This is Varsha from Tejas Academy and we are going to have a speaking live session. I welcome you all to this yet another live session from Tejas Academy. So this is Varsha here and today we are going to discuss a home visit on wound management and wound dressing. So once again, I welcome you all to this live session from Tejas Academy. This is here Varsha with you. So we are going to discuss a home visit in speaking, OET speaking role play. So I'll just wait for a couple of minutes for my participants to join and then we'll start with the session. Hello everyone, I hope everyone is doing fine. You people are practicing with the speaking also. So as I mentioned, this is a home visit and it's on a wound management and dressing. So let's quickly move on to the, yes, people are joining. I'll wait for a couple of minutes and then we'll move on. Okay, so this is our this is the topic of discussion here. So this is our role play. So as we know that we have to decide the type of, the case, or we will be discussing on the introduction for a particular situation based on three different things. So we always decide the introduction based on three different things. That is the setting, scenario and the first task. Okay, so you always have to go with the introduction based on these three things. The setting here is a patient's home. As I already mentioned, it is a home visit, and just beneath the scenario there is a scenario given. It is a description which gives us three information. The first thing, to whom we are going to speak with, and the second thing, what is our description, I mean who are we, and the third thing is, so what is the topic of discussion. So these three things will be given in the scenario. Okay, മൂന്ന് കാര്യങ്ങളായിരിക്കും ബേസിക്കലി സിനാരിയോയിൽ പറഞ്ഞിട്ടുണ്ടാവുക. നമ്മൾ ആരാണെന്നുള്ളതും അതുപോലെ തന്നെ നമ്മൾ ആരെയോടാണ് സംസാരിക്കാൻ പോകുന്നുള്ളതും ആൻഡ് ദെൻ ഫൈനലി നമ്മൾ എന്തിനെ പറ്റിയിട്ടാണ് സംസാരിക്കാൻ പോകുന്നത്. അപ്പോൾ ഈ മൂന്ന് കാര്യങ്ങളായിരിക്കും നമ്മുടെ സിനാരിയോയിൽ ഗിവൺ ആയിട്ടുണ്ടാവുക. Okay, so to move on, so just like I mentioned, it's a patient's house. So you are a community nurse visiting a 7-year-old child at home for a routine wound dressing change. The child has a healing surgical wound on their left forearm. Give advice on wound care. So ഇതാണ് നമുക്ക് തന്നിട്ടുള്ള സിനാരിയോ ഡിസ്ക്രിപ്ഷൻ. തൊട്ട് താഴെ ഒരു ടാസ്ക്, നമ്മുടെ ടാസ്ക് നമ്പർ 1 കൂടി നമ്മൾ നോക്കേണ്ടതാണ്, അത് ഇമ്പോർട്ടൻ്റ് ആണ്. സോ ദിസ് ടാസ്ക് നമ്പർ 1 is find out how they have been managing their child since your last visit. So I hope you got adequate information with these three things so as to go with the introduction. Adu clear aayi ennu njan pradishikkunnu. So could you please tell me what type of visit is this? Because when it is a home visit, the first important thing that we need to decide is the type of visit. What type of visit it is? So we have different situations in home visit. For instance, it can either be initial visit or routine regular visit, or else it can either have, we can either expect a home visit with a merged situation. For instance, a routine, when you have been, you are here for a home visit but you've already done the assessment on the patient. So anganthe situation varam. So can I get a response from your side? What type of visit is this one? Anyone here? Hi Rakul, good morning. So the rest of the people here who have joined this live session, can I just know what do you feel about the type of visit here? What type of visit is this? What do you feel? Yes, Angel, very good. It's a follow-up visit. Very good, Angel. Anyone else? Have you got an idea? What type of a visit is this? So Angel has commented it's a follow-up visit. Okay. So നമുക്ക് എങ്ങനെയാണത് മനസ്സിലാവുന്നത് that it is a follow-up visit? How do we get an idea, or where do you got an idea that this is a follow-up visit? എങ്ങനെ മനസ്സിലായി? It is given here in the scenario that a routine wound dressing. So you are here, the child requires a routine wound dressing. Okay, so this is from this situation or from this particular sentence we will be getting an idea that it is a routine wound dressing change. So you are here for yet another visit. This is not your first visit anyway. And also when you go through the first task, find out how they have been managing their child since your last visit. It's been mentioned since your last visit. Again, this is an indication that it is a routine visit or it is a second time visit. Alright, who is the your here? It is the nurse. So since your last visit means it is the nurse's second visit. I hope you got an understanding. So from this particular situation, we got an idea that this is a routine visit and you are paying a visit to a child's home. The child is 7-year-old and you are here. The purpose of your visit is to change the child's wound dressing and you also give advice on wound care. Can I know to whom are you speaking with? ആരോടാണ് നമ്മൾ ഈ ഒരു കോൺവെർസേഷനിൽ സംസാരിക്കുന്നത്? To whom are you going to speak with? Could you please tell me? To whom are you going to speak with in this conversation? Can I have some response from your side? So what is the interlocutor's role here? So we have two people I guess here. നിങ്ങൾ ആരോടാണ് ഈ ഒരു കോൺവെർസേഷനിൽ സംസാരിക്കുന്നത്? Are we going to speak with the child? Is it a conversation with the child? The child is 7-year-old and we are here for the child only. But ഈ ഒരു conversationൽ are we going to speak with the child? So can I have some response from your side? Also it is a home visit and we are going to change the wound dressing for the child. So we are here for the child, but are we going to speak with the child really? That is my question. And it is a routine visit also. So our പേരായിരിക്കും നമ്മൾ preparation ടൈമിൽ ചോദിക്കേണ്ടത് and also how to begin with the introduction. Okay, Angel has again commented family, father or mother. Very good. See, we won't be speaking with the child anyway. എന്തായാലും നമ്മൾ കുട്ടിയായിട്ട് സംസാരിക്കാൻ പോകുന്നില്ല. So we're going to talk with either the father or the mother. Alright, again this is a routine visit. Yes, Rakul has also commented who is taking care of the child for wound care. Very good. Alright, thank you so much for these. And yes, so this is a 7-year-old child. So we are not going to talk with the child anyway. We will be speaking with either their father or the mother or the carer who is taking care of the child. Alright, very good Rakul. Yes, it is parents. We are going to speak with the parent. So you know, we got an indication from about this thing from the scenario, managing their child. You might have noticed this word, managing their child. That means we are going to speak with the parent, which is not given in the scenario also. Alright, so this, since it is a home visit, you need to ask the name. May I know whose name you will be asking? Whether you will be asking the child's name or the parent's name. Can I know about it? Can I have some response from your side now? So this is your second visit and you are here for the child, but I want to know whose name you will be asking. Is it the child's name or the parent's name? Can I get some response from your side? See, this is a bit of a tricky kind of a home visit because it's a routine visit and the child is minor. So we'll be speaking with the parent. If in case it was an initial visit, we would have asked their name during the conversation. But again, this is a routine visit. So definitely we have met them before. So will you be asking the parent's name or the child's name during the preparation time? That is my question. Okay, I guess you people are confused now. So what you can do here is like, so you may ask the parent's name during the conversation itself. And how do we go with asking their name during the conversation? You can just say, could you please remind me your name once again? Or for our better communication, may I just know your name? Could you please state your name once again? So this is how you can go. So what about the introduction now? At first, we'll be greeting them. Well, good afternoon. I hope you remember me. This is me, Varsha, from the Community Health Center, and I'm here for the routine wound dressing change and also give some advice on the wound care. So may I know, is this the right time for the same? Alright, thank you for your willingness. And can I just know your name for our better communication? Could you please remind me your name once again? So we'll be asking the child's name, the parent's name once again. I hope you got an understanding. Yes, Gopika Pratap, very good. Gopika, we'll be asking the child's name, definitely. Always go with the patient's name during the preparation time and we'll be asking bystander's name during the presentation. Okay, so we don't need to make the confirmation about the residence and the right person here since it is a routine visit. So we'll be just saying, well, good afternoon or good morning. So let me just, good morning. Let me remind you once again, my name is Varsha. I am a community health nurse and I'm here as per your GP's advice for the routine wound dressing change and also to give advice on wound care. Well, is this the right time to do the same? Thank you for your willingness. And could you please remind me your name once again for our better communication? This is how it will work. I hope you got it. And then we'll be proceeding with the first task. So could you please tell me how you have been managing your child since my last visit? So whatever the response is, you need to give a counter response. If the person is saying things are really good, everything fine, then we need to give an appreciation. If the person is saying still concerned, so they have some concern or they are expressing their anxiety or concern to you, then we have to, what we need to do is, we need to give a reassurance there. Okay, according to situation ആയിരിക്കണം നിങ്ങൾ ഒരു മറുപടി കൊടുക്കുന്നത്. For instance, ഇപ്പോൾ അവർ നിങ്ങളോട് പറയാണ്, see, I was taking care of the wound in a pretty good manner, everything is fine and I feel like everything is okay എന്ന് പറയുകയാണെങ്കിൽ ഒരു appreciation ആണ് വേണ്ടത്. Well, I really appreciate your willingness to do all the same and I really appreciate that. If in case ഒരു anxiety express ചെയ്യണമെന്നുണ്ടെങ്കിലോ, you don't have to be tensed, I'm here, I will definitely make sure that everything will be alright with your child. Okay, this is how it will work and we'll go to the first task now. The second task. Ask about the wound. So again we are going with the history. History collection is something which we are going to do now. So history collection like proceed munne we need to seek permission, right? So either ask another task aanu. That means we have to ask questions. It is gathering information. But before that you need to ask permission to the person. So before proceeding further, I would like to know about your child's wound. Will that be fine? Okay. ഇനി ആ questions ശ്രദ്ധിച്ചു നോക്കൂ. Any pain, redness or swelling around the wound, any fever or discomfort since the last dressing change എന്നാണ് പറഞ്ഞിട്ടുള്ളത്. സോ നമുക്ക് ആദ്യമേ wound related ആയിട്ടുള്ള സിംറ്റംസ് എല്ലാം നിങ്ങൾക്ക് വേണമെങ്കിൽ ഒന്നിച്ച് ചോദിക്കാം. That is till here. Okay, so we'll be going with this one at first. So may I know if in case your the parent's name is Helen. Well, Helen, so could you please tell me, did your child complain of any pain? എന്ന് വേണം മെൻഷൻ ചെയ്യാൻ. So do you experience any pain? നമുക്കത് നമ്മൾ ഫസ്റ്റ് പേഴ്സണോട് ചോദിക്കാം. പക്ഷേ വേറൊരാളുടെ പെയിൻ the person won't be able to make a response. Is your child experiencing pain? എന്ന് കുട്ടിക്കേ പറയാൻ പറ്റൂ. So what we are going to say here is, did your child complain of pain? Okay, can I just know, did your child complain of any pain and did you notice any redness or swelling around the wound? Oh well, and is he having any fever or discomfort since the last dressing change? See, I've splitted here the question because most of the question is like everything is related to the wound only, but certain question is particularly related to the wound and the other is like general question. അപ്പോൾ ഞാൻ അതിനെ സ്പ്ലിറ്റ് ചെയ്തു. ബട്ട് ഇവിടെ പെയിൻ എന്ന് പറയുമ്പോൾ അതൊരു സെക്കൻഡ് പേഴ്സൺ ആയതുകൊണ്ട് തന്നെ what you need to do is നമ്മൾ ആ രീതിയിലായിരിക്കും question raise ചെയ്യുക. So could you please tell me, did your child complain of any pain and have you noticed any redness or swelling around the wound? Well, is your child having any fever or discomfort since the last dressing change? Well, thank you for sharing this information with me and I'm really happy that you have responded. So then, reassure the parent about the wound എന്നാണ് പറഞ്ഞിട്ടുള്ളത്. But before that, we need to go with examination. So that is very important. At first, we'll go with examination and then you have to do the wound. We'll be giving information about the wound. So at this point, just make a note whenever you're giving information about a wound. So you have to say, you have to go with the examination. And now at this point, could you please allow me to just examine your child's wound? Oh well, yeah, thank you for allowing me to do the examination. I can reassure you that you don't have to worry about anything about this wound because the wound is healing pretty well and there is no signs of infection as of now. It is good. Also, I would like to say that you need to focus on this wound care. This wound care is really necessary. But you don't have to be tensed about the same because I will just remind you about the wound care measures once again. So this is how we'll be going. Okay, so there are combined task aanu. We'll be combining it together, but there should be a, you need to signpost it. ഒരുമിച്ചങ്ങ് പറഞ്ഞു പോവാണ്ട് അത് പ്രോപ്പർലി ആ ഒരു ചേഞ്ച് ഇൻ ടോപ്പിക് വരുന്നത് എന്ത് ചെയ്യുക, ഇൻഡിക്കേറ്റ് ചെയ്ത് കാണിക്കുക. Okay, so thank you for allowing me to examine the wound. Well, I would like to reassure you that you don't have to worry about anything. The measures you have done is pretty fine because the wound is healing well. There is no signs of infections as of now. And also, I would like to tell you that it is very necessary to follow the wound care measures which I have mentioned. So at this point, I would like to remind you the wound care measures once again. So shall I proceed with the same, Helen? Well, thank you. So first of all, you need to keep the dressing clean and dry so as to prevent any infection. See, there is a colon here. So avada nammal endengilum kayil add ചെയ്തിട്ടാണ് avada connection കൊണ്ടുവരേണ്ടത്. So what we'll be saying here is, you need to, first of all, you need to keep the dressing clean and dry so as to prevent any infection. And secondly, avoid rough play or scratching the area. Please instruct the child to do the same. അപ്പോൾ അത് കുട്ടിക്കുള്ള അഡ്വൈസ് ആണ്, നമ്മൾ ആ രീതിയിൽ വേണം മെൻഷൻ ചെയ്യാൻ. So I advise you to please tell the child to avoid any rough play or scratching the area. In addition, certain analgesics, that is the painkillers, is being given to your child. If in case he is experiencing pain, please do provide your child with the pain medication. അപ്പോൾ analgesics എന്നൊരു word അവിടെ is a medical term which the person might not be able to follow. So what you can do here is give the substitution for the same. Okay, because we have to follow the proper appropriateness of language. അതുകൊണ്ട് തന്നെ pain medication എന്നും കൂടി include ചെയ്യാം. Okay, in addition to that, always tell your child to keep himself hydrated. Other than that, you need to provide him with good nutritious food also. അപ്പോൾ ഈ good nutrition എന്നുള്ളത് actually it won't be perfect if you just stop there. So we need to give an advice regarding a good nutritious food for the child. So can I ask you, what is the good nutritious food for a child who is recovering from a wound? So the person has got a surgery and he is recovering. For recovery boost ചെയ്യാൻ പറ്റുന്ന ഒരു woundന് പറ്റിയ ഒരു nutrition എന്തായിരിക്കും? What kind of a diet is much more preferable for the child now? Are you people with me? So what will be your advice here? And the kind of diet aanu kuttike better, because we are saying the person that good nutrition is important. So what is that good nutrition, or what are we supposed to provide? Adana nammal avada chodikkendathu. All right, so ningal endayirikkum avada mention cheya? Good nutrition, so as to get the wound heal much better. So what will be your piece of advice for them? Because if you say try to provide your child with a good nutritious food, എന്ന് പറഞ്ഞാൽ ആ ഒരു സ്റ്റേറ്റ്മെന്റ് അവിടെ ഒരു കംപ്ലീഷൻ ഇല്ല. ഇറ്റ് ഇസ് യുവർ റെസ്പോൺസിബിലിറ്റി ടു ഗീവ് ഫർദർ ഇൻസ്ട്രക്ഷൻ. എന്താണ് ഈ ഗുഡ് ന്യൂട്രീഷൻ എന്നുള്ളതും കൂടി നമ്മളൊരു ക്ലാരിറ്റി കൊടുക്കണ്ടേ. ഹോംലി ഫുഡ് മാത്രം കഴിച്ചതുകൊണ്ട് കാര്യമായില്ല. ദർ ആർ സർട്ടൻ റിക്വയർമെന്റ്സ് വിച്ച് the person need to meet. Yes, very good Gopika, very good. We need to provide, you can advise them to provide with protein rich food. അപ്പോൾ നിങ്ങൾക്ക് അവിടെ ഒരു അഡീഷനും കൂടി ഇൻക്ലൂഡ് ചെയ്യാം. വാട്ട് യു ക്യാൻ സേ ഹിയർ ഇസ്, സോ ആസ്ക് യുവർ ചൈൽഡ് ഓർ ജസ്റ്റ് മേക്ക് ഷുവർ യുവർ ചൈൽഡ് ഇസ് കീപ്പിംഗ് ഹൈഡ്രേറ്റഡ്, ഹി ഈസ് ടേക്കിംഗ് enough water. Also provide your child with good nutritious food, which include, I would say, go with protein rich food. And if you want some information regarding the same, I'll provide you with a leaflet so that you can have much more clarity as to what is this protein rich food, and this will definitely help your child to get a speedy recovery. അതും കൂടി നമുക്ക് അവിടെ മെൻഷൻ ചെയ്യാം. ഓക്കെ, സോ ജസ്റ്റ് ലുക്ക് ഫോർ ദ വേർഡ്സ്. കോമൺ മാനോടുള്ള ഒരു കോൺവെർസേഷൻ ആയതുകൊണ്ട് തന്നെ യു ഹാവ് ടു മേക്ക് ഷുവർ വാട്ട് എവർ യു ആർ സേയിങ് ദ പേഴ്സൺ ഇസ് ഏബിൾ ടു ഫോളോ ഇറ്റ് ഇൻ എ വെരി പ്രോപ്പർ മാനർ. ദാറ്റ് ഇസ് സംതിങ് വിച്ച് യു നീഡ് ടു മേക്ക് ഷുവർ ഓഫ്. ഓക്കെ, പ്രൊസീഡിങ് ഫർദർ. അപ്പോൾ ഇത്രയും കാര്യങ്ങൾ പറഞ്ഞു കൊടുത്തതിന് ശേഷം who is supposed to follow these wound care measures? The mother is supposed to advise their child. Will you be able to follow എന്ന് കംപ്ലീറ്റ്ലി പറയാണ്ട്, കാരണം ഇവിടെ അവർ ഫോളോ ചെയ്യേണ്ടതുകൊണ്ട് കുട്ടിക്ക് പറഞ്ഞു കൊടുക്കേണ്ടതുണ്ട്. സോ ഐ ഹോപ്പ് യു വിൽ ബി ഫോളോയിങ് ദിസ് ഇൻസ്ട്രക്ഷൻ ആസ് വെൽ ആസ് ലെറ്റിംഗ് യുവർ ചൈൽഡ് ഡു ദ സെയിം എന്നൊരു കാര്യം കൂടി അവിടെ മെൻഷൻ ചെയ്യാം. ഇനി അതിൽ അടുത്തതിലേക്ക് പ്രൊസീഡ് ചെയ്യും മുന്നേ നമുക്ക് വേണമെന്നുണ്ടെങ്കിൽ ഒരു ക്വസ്റ്റനിലേക്ക് പോകാം. ബിക്കോസ് വി ഹാവ് ബീൻ എക്സ്പ്ലെയിനിങ് എവറിഥിങ് ഓൾ ബൈ അവർ സെൽഫ്. സോ വി നീഡ് ടു മേക്ക് ഷുവർ വെദർ ദേ ഹാവ് എനി ക്വസ്റ്റൻസ് അറ്റ് പ്രസന്റ്. So we'll proceed with the question here. So would you like to ask me any question, Helen? So the question might be, so what are the signs of infection, or else when to seek medical attention? When should I just seek medical attention? So avada nammal endu cheyunu, aa oru question choichadinu vendite definitely you can give, you can appreciate the person. At first this is something which you can do. Well, I really appreciate your inquiry, Helen. I can see that you are a very lovable parent and your sound shows the love and care that you have for your kid. Well, I can advise you from my side that you need to seek medical attention if you notice any signs of infection. Well, do you know what are the signs of infection? എന്ന് വേണമെന്നുണ്ടെങ്കിൽ ഇവിടെ ഒരു ക്വസ്റ്റ്യനും കൂടി റേസ് ചെയ്യാം. Why? Because checking their understanding also. Okay, so including their perspective into the conversation also. So I don't know എന്നുള്ള ഒരു റെസ്പോൺസ് ആയിരിക്കും കിട്ടുക. Well, let me tell you about it. So if he is complaining of any increased pain and you notice any yellow or green discharge coming out, and if in case he is having fever, then please don't worry, you don't have to be panicked. These are signs of infection and you don't need to worry. Please bring him to the department and we'll be here. We'll be there to help you with your child's condition. So I can say that you don't have to be tensed. As of now, your child's wound is healing pretty good. But if in case these symptoms may arise in future, please do get back to us. It is very necessary. അത് കഴിഞ്ഞിട്ട് നമുക്ക് അവരോട് make sure ചെയ്യാം. So are you able to follow my advice, Helen? Oh well, thank you for the same. And finally, വേറെ എന്തെങ്കിലും ഒരു question ഉണ്ടോ അല്ലെങ്കിൽ എന്തെങ്കിലും questions അവർക്ക് raise ചെയ്യാനുണ്ടോ എന്നും കൂടി make sure ചെയ്യാം, because there is a change in topic. We are going to discuss about the recovery. So if you want, you can raise a question here. Would you like to ask me any other doubts that is bothering you at present? So I want to know about the recovery, how long it will take എന്നുള്ളതായിരിക്കും maybe parent concern. So we'll be advising them on the same. Well, definitely that's a valid question from your side, so I will explain it to you. Well, I can reassure you that as of now his recovery is pretty much satisfactory, and the complete healing will take around 3 to 4 weeks of time. Also, I request you to provide your child with proper rest. 1 month rest is completely advisable for your child so as to get a speedy recovery from his current condition and also for a better healing. So I hope you will be keeping this thing in mind. എന്നും കൂടി എന്ത് ചെയ്യാം, അവിടെ അഡ്വൈസ് കൊടുക്കാം. ഓക്കെ, വേണമെന്നുണ്ടെങ്കിൽ അവിടെ റീഅഷുറൻസും കൂടി നിങ്ങൾക്ക് ആഡ് ചെയ്യാം. ദ വൂണ്ട് ഇസ് പ്രിറ്റി മച്ച് ഫൈൻ നൗ, സാറ്റിസ്ഫാക്ടറി റെസ്പോൺസ് ആണ്, ആൻഡ് ഓൾസോ ഹീലിംഗ് ഗുഡ്, സോ യു ഡോണ്ട് ഹാവ് ടു ബി ടെൻസ്ഡ് എന്നൊരു റീഅഷുറൻസും കൂടി നിങ്ങൾക്ക് അവിടെ പ്രൊവൈഡ് ചെയ്യാം. And one important thing that you need to do is, actually we came here to do something. We were here to have a routine wound dressing, most important thing, and then wound care. Advice on wound care we have done, but we didn't do the wound dressing change. So towards the end, adu ningal at least ഒന്ന് എഴുതി വെക്കുക dressing change എന്നോ മറ്റോ, so that you will be including that as well. So you have to complete your task in a very proper manner, which is according to the scenario. Towards the end parayam. So I believe that I was able to address all your concerns regarding your child's wound. So with your permission, can I just proceed with the dressing change? Well, thank you so much for that. So I'll do the dressing change now. Meanwhile, I would like to just recap what we have discussed so that you will be keeping all these things in mind, and also you will be having a better understanding. In the paranittu, we will just recap the things once again for them. So I believe you people got an understanding of this particular role play card. So today we were discussing about a home visit on wound management as well as dressing. അപ്പോൾ ഇതായിരുന്നു നമ്മൾ ഇന്ന് ഡിസ്കസ് ചെയ്തുകൊണ്ടിരുന്നത്. എല്ലാവർക്കും മനസ്സിലായി എന്ന് തന്നെ ഞാൻ പ്രതീക്ഷിക്കുന്നു. If you have any questions, please do let me know the same. Is everything fine? Is everything clear to you? Are you people with me? Any questions? So it was a home visit on wound management and dressing. So mostly whenever you're coming for this thing, when you are there for a wound, especially this dressing change and all, make a note of the same towards the end, because otherwise we won't be saying it. Okay, so it was a routine visit from our side. So, and also again, to make it a bit more complicated, it was a conversation with the bystander. So we have asked the parent to remind the name once again to us, and then we proceeded with the task. At first we asked the person questions, again a question regarding the wound, then we proceeded with the examination, reassured the person about the wound management and also wound care measures we have instructed them, and towards the end we have given advice on when to seek medical attention, and finally on the recovery. So thank you so much people for being here. It was really I felt happy and also I felt engaging. See, if you people are responding, I will get an impression that you are there with me. So I felt really happy with the same. Do join the next live session. We'll be meeting on every Monday at 10 o'clock, 10:15. I'll be here. So thank you so much for joining, and wishing you all the very best for your OET journey. So if you have any doubts regarding anything, you can please comment down. I'll be here to help you with the same. I wish you all a very good day, and once again, thank you people for joining. Thank you.